Okay, so our facilitator for today is Dr. Adebowale Oluwawemimo. Dr. Adebowale Oluwawemimo is a professor of veterinary public health in the Department of Veterinary Public Health and Preventive Medicine, College of Veterinary Medicine, Federal University of Agriculture, Abeokuta, FUNAB, Ogun State, Nigeria. She obtained her Doctor of Veterinary Medicine and Master's degree in Veterinary Public Health from the University of Ibadan, Nigeria. In 2011, she was awarded the prestigious United Kingdom Commonwealth Scholarship, through which she completed her PhD at the Royal Veterinary College, University of London, in 2015. She further strengthened her expertise by obtaining a diploma fellowship in antimicrobial resistance and One Health through the Mary Cox Foundation and Université Paris Cité, France. Her research focused on food safety, particularly the investigation of patterns, drivers, and farm level risk factors for antimicrobial use and resistance in livestock production system. Her broader interests include infectious disease epidemiology and control, as well as One Health approaches to global health challenges. Professor Adebowale has served as a member of the quadripartite, that's WHO, FAO, WOAH, and UNEP, Technical Working Group on Integrated Surveillance of Antimicrobial Use and Resistance from 2023 to 2025, which provides technical guidance on strengthening country surveillance capacity. She is currently a member of the World Organization for Animal Health and HOC group on the prioritization of diseases for which vaccine could reduce global antimicrobial use in animals. In addition, she serves as a global assessor for the Royal Society of Tropical Medicine and Hygiene for the 2025 to 2028 term. She actively contributes to capacity building initiatives and has published widely in local and international peer-reviewed scientific journals. She has also received several competitive travel grants to present her research at national and international conferences. So if you are very excited to hear all that Dr. Adebowale has to say to us, I need us to give virtual emojis, type in the chat box, and let's just welcome her to the stage. Let's welcome her to the stage. We can clap. Zoom allows us to clap virtually. Let's clap as I welcome Dr. Adebowale to the stage.
Oh, thank you very much, the moderator. I hope you can all hear me. I hope I'm audible enough.
Yes,
Can
ma'am.
you all hear
I
me?
can hear you, ma'am.
Okay,
Please let's confirm
thank
that
you
we can
so
hear her.
much. Next Generation Antimicrobial Stewards Initiative. Thank you for having me on your platform. I also want to appreciate everyone that is joining us for this webinar. Thank you for your time. I will just go straight to my talk. I will share my slides, and please, if you can see it, let me know. Can you see my slide?
Yes, ma'am. Yes, we can.
Okay, that's good. So I will start with going straight to my topic, which is combating antimicrobial resistance in animal health, strategies for sustainable practices. And I have here my talk overview. So along the line, I will be defining keywords or terms. And then we will look at antimicrobial usage pattern and practices. We'll look at that from the global and the local contexts. We'll also talk a bit about what drives antimicrobial resistance in animal health and the impact on animal health. Also, we'll touch a bit on antimicrobial stewardship, sustainable alternatives, as well as the way forward. So let's dive straight into the topic. So I will start by defining what antimicrobials are. And if you are very conversant with the word antibiotics, I'm sure you know that many people use antimicrobials and antibiotics interchangeably, but there's a difference. And so we'll talk a bit about the difference today. So let's understand what antimicrobials are. So antimicrobials are medicines or drugs, and in some other health sectors, for example, in plants, to treat or prevent infections that are caused by bacteria, fungi, parasites, and viruses. So what is the difference between antibiotics and antimicrobials? Like I said, or the other time, we often use them interchangeably. And I highlighted here that all antibiotics are antimicrobials, but not all antimicrobials are antibiotics. So your antimicrobial is like an umbrella under which you have drugs that comprise your antibacterial, antivirals, your antifungal, as well as your antiparasitics. In the case of antibiotics, they are usually antibacterial drugs. And if you also look at the scope, your antimicrobials are quite broad. So what I mean by that is that they are broad and they target bacteria, they target viruses, parasites, as well as fungi. But in the case of our targets, bacteria. So don't mind me, I will be using this interchangeably, but course could be on antibiotics. Is that okay? So now the next slide, here we are looking at timelines showing that antibiotics have existed tens in the 1900s. And the first antibiotics that was developed is salvarsan, even though it's no longer in clinical practice. And then all through the years, we've had new antibiotics that have been developed. But for the recent time, let me say in the past decades, we've had issues in developing new antibiotics. And that is why we need to optimize that we have now to ensure that they are still working. So antibiotics come from different sources. So antibiotics can come from bacterial natural products. An example of that is your polymyxins under products from fungi, that can be used, that have been used as antibiotics. An example of that will be your penicillins. We all know penicillin. And then we also have synthetic antibiotics. These are chemically produced antibiotics. So you can have natural antibiotics, you can have semi-synthetic antibiotics, and you can also have synthetic antibiotics. So antibiotics are critical in animal health. I would say animal health depends on let me put it this way, judicious use of antibiotics. It plays a critical role in animal health and in food security. So in the veterinary medicine, we use antibiotics for a wide range of different animal population. We use them in your food animals. Food animals are animals that we raise for human consumption. And you can see I highlighted that in red because I'm going to use it are used in this population of animals globally, let me put it that way. So an example of your food animals are your poultry, cattle, I'm sure you know the rest. And then we also use antibiotics in companion animals. Companion animals or your household pets, like your dogs, your cats. Some people have horses as pets, rabbits. We also use them in wildlife animals. So what are the primary purpose or indication of using antibiotics in animal health? For treatment, for prevention and for control of infectious animal diseases, as well as zoonosis. It is important for me to clarify that not all infectious diseases are zoonotic. So in a way, your anti-vent to treat or control as well as zoonosis. Zoonoses are diseases that can be transmitted from your animals to humans. So if we judiciously use antibiotics, it has a lot of benefits for us. Number one, it will enhance food animal production. Also, it will also promote food safety. So there will be less, how do I put it, cases of food transmitted diseases like foodborne diseases or food illnesses. It will also enhance public health as well as prevent transmission of zoonotic diseases from animals to humans. So let's look at the global picture of antimicrobial use in food animals. And I came across this paper, and I think it's nice for me to share. This paper was published in 2024, so it's very recent. And it has projected that by the year 2030, the animal production systems will be consuming over 107,000 tons of antibiotics. That is alarming. And that is a increase in antibiotic use is because the increasing I would say probably every minute. So when there's ongoing increase in human population, you would expect that the global demand for animal proteins will also increase. And when we have increase in global demand for animal proteins, you see that our farming system shifts from what we know as traditional farming system into more intensive animal production. And they benefit, but they also have their limitations. And one of the limitations is the overuse of antibiotics. If you look at the plates, that is figure 2 there, you will see the predicted population, human population according to regions. And you can see there that by the year 2050 in sub-Saharan Africa, we will be clocking about 2.1 billion people. So there will be a lot of demand on animal protein. There will be shifts in animal farming system, and then there will be increased use of antibiotics. Also, this paper is also very important. This also is very recent using animals. And this paper, documented the top 5 consumers of antibiotics globally: China, Brazil, India, US, and Australia. And it is also very important for us to know that 58% of the of antibiotics used globally are used in veterinary medicine. And also, by 2030, our dependence on antibiotics in Africa would increase by 25%. So there is a need for us to check indiscriminate use of antibiotics. Also, documents and it's specific, which means that the antibiotics that we use or the frequently used antibiotics may vary from one country to another. Also, we have different hotspot area for antibiotic use. You can see that the large bubbles there, majority of the antibiotics are used in Asia, then followed by Europe. Then in Africa, you can see that South Africa is a hotspot for antibiotic use. And if you can see that figure, you can also see Nigeria as well use substantial antibiotics in food animal production. So what is the picture of antibiotic use like? So I was able to several publications, and at the end of the day, we're talking about our antimicrobial use in food animal production system. The studies highlighted that indiscriminate use of antibiotics is common and is the major driver of the development of antibiotic prescription. So we have both the formal and informal prescription practices. So formal prescription practices, these are prescriptions that you get from your veterinarians. Informal prescriptions, these are self-administered drugs, maybe by farmers or by other stakeholders. Then tetracycline group of antibiotics is frequently used, just like the global report. And then not in any particular order. We also have beta-lactams, aminoglycosides, and fluoroquinolones frequently used. Also, there's a need for us to know that there is still a poor awareness of antimicrobial stewardship and antimicrobial resistance in veterinary medicine, especially among farmers. There is inadequate diagnostic and surveillance capacity for AMR monitoring and to help us to be able to make informed decision. And if you keep just few recent studies that we have conducted in different parts of the southwestern states of Nigeria. This is a study that my postgraduate master's student completed late last year, and he looked at quantifying as well as assessing the biosecurity levels and antimicrobial use in commercial layer farms in Ogun State. This study was conducted in the space of, I would say, 8 months. And within 8 months, we recorded that 70 different antimicrobial brands were used by farmers. And most frequently used antibiotic drugs were under the classes of the tetracyclines, the fluoroquinolones, the beta-lactams, and the aminoglycosides, which corroborates previous studies that have been conducted. In addition to that, we further classified the antibiotics into, I would put it this way, into 2 WHO frameworks. We call them the medically important antimicrobials. And then we have the AWARE, which is the access. Why did we do this? As clarify, 2 frameworks were developed by the WHO so that they can help to guide, responsible use of antibiotics, as well as support antimicrobial stewardship to combat antimicrobial resistance. So the WHO AWARE group classifies antibiotics based on their importance, also their resistance risk, as well as their recommendation level of use. That these drugs have low resistance, they have low resistance risk. And I want to also say this, that the United Nations General Assembly high-level meeting that was conducted last year has given us a target, the health sectors a target, that 70% of antibiotics used globally must come from this access group. And that is because they have low risk of resistance. Then you have the watch group. These watch antibiotics are antibiotics that have high resistance, high resistance risk, and caution must be taken while using them. So we need to optimize their use. Reserve, when you look at that word reserve, these are for last resort antibiotics. An example is your colistin. So these antibiotics are antibiotics that you use, they are the last solution for multi-drug resistant infections. When you look at the medically important antimicrobial, which is the second framework, this second framework categorize or classify antibiotics based on their. So if we use this we did, going back to this work, we found that under the AWARE, majority of the antibiotics used in poultry in this study were under the watch group. These are antibiotics that we should be cautious about. We should optimize because of high, that means we are using antibiotics that have high resistance risk. And then with the medically important antimicrobials, we found that we use majority of antibiotics within the critically important ones and the high important antimicrobials. But look at that the highest priority critically important antimicrobial. This is telling us that we also use to an extent drugs that are within this group or this classification. Example of that is your colistin. So I actually, do I say highlighted colistin? Because after quantifying the amount of antibiotics used, we found out that colistin highest quantity of quantity. So which means in the poultry production, system in Ogun State, there's a high level of colistin we need to be concerned about. Colistin is of highest priority, clinically important antimicrobial. If you look at the second classification, the AWARE, it is a reserve antibiotics. That means it's a last resort antibiotics that treats multi-drug resistance. But unfortunately, we are using this indiscriminately in poultry production. This is also another study we did in pig, and we did both. We used qualitative methods to understand their perception about what drives them to use antibiotics indiscriminately, and then we found that all antibiotics probably in the last 6 months. The most common antibiotics that are used in pigs are antibiotics under the classes of tetracyclines, under aminoglycosides, as well as the beta-lactams. You have them using more of penicillin and amoxicillin. So what is their perception? What was their perceptions? They use antibiotics indiscriminately. I'll just point out just 2 or 3. Farmers are profit-oriented. No farmer wants to go into business and, how do I put it now, run into loss. So they will do anything to make profit. So antibiotics, this drive to make profit also drive indiscriminate use of antibiotics. Number 2, they also perceive that poor security alternatives to antibiotic, poor security vaccination, they were also drivers for indiscriminate use of antibiotics. Other things they mentioned were that they use antibiotics when for syndromic indication. They have not confirmed the disease, but when they see that animals are probably, they have diarrhea, they are vomiting, they are anorexic and all that, they give them antibiotics. And then we also ask them for what purposes do they use antibiotics for? And they said for prophylactic, for therapeutic purposes. And basically, these are driven by previous experience, maybe by prescription, I would say informal prescription by farmers, and then also because of inaccessibility to veterinary services. Important to also mention the accessibility to over-the-counter drugs also was one instance why this is a big sector. So let us look at aquaculture. This was also and their West Nigeria cost on the fish, and you can see that it is usually the same antibiotics, tetracyclines, your fluoroquinolones, aminoglycosides, and there's a level of use of colistin as well in fish farming. So the previous perception on drivers of antimicrobial use is basically the same thing, even in the fish production system. Now, let's look at antimicrobial use and the impacts on one health, that is animals, humans, and the environment. And like I mentioned previously, over antibiotics globally are used in veterinary medicine. And its overuse and misuse of antibiotics in veterinary medicine has been implicated in critical consequences such as the emergence of AMR in animals, humans, and even in the environment. So overuse of antibiotics, when we say overuse of antibiotics, is you are using more than what is needed. Is that okay? And then when we talk about misuse means you are using those antibiotics incorrectly. And then aside from that, there's also the effect that has on the environment is because you have residues of antibiotics, you have antibiotic resistant genes and bacteria being introduced into the environment. If you look at that plate, the figure there, you can see what happens. So what happens when you use antibiotics in animals or in livestock? So once they get introduced to antibiotics, there is a shift in the gut microbiome, including antibiotic-resistant pathogen. And there are different transmission pathways or pathways of spread to humans. So for instance, if you give antibiotics to animals, and their genes can find their way into animal products, like animal food products. And this, indirectly through consumption can be spread or can be transmitted to humans. You have other ways. Unfortunately, this is a pathway that we've neglected, that is being neglected, the environmental sector. Your animals that are injected with antibiotics, you have the residues in their manure. And once this gets into the environment, you can it can get into the soil, it can get into the water, surface water, groundwater, and eventually it gets to humans because we use some of these water sources for domestic purposes and even for drinking. Then you can have the direct transmissions to veterinarians, farmers, and other stakeholders. Now, we've mentioned about antimicrobial. I think there's a to define what antimicrobial resistance is. So antimicrobial resistance occurs when bacteria, please note that I'm including bacteria, viruses, fungi, and parasites, no longer respond to medicines that they would normally respond to. So making these specific treatments ineffective. And when treatments are ineffective, you have increasing spread of infection. They become very difficult to treat. You have increasing illness and then death. I would say AMR, associated death. I have here another article that shows the development of antibiotics and emergence of resistance to these antibiotics. If you look at methicillin was developed in 1960. By 1960, has been if you look at in 1987, 85, by 1987, we've reported resistance to it. So it seems right now that the bacteria, resistant bacteria are winning the war. If you look at it, I said recently, now we don't have new antibiotics in the pipeline. And bacteria what to evade antibiotic treatment. So, which means the antibiotics we have now, we need to be what responsible stewards of the existing antimicrobials, making sure that they still work. So how do antibiotic resistance develop? So just picture an animal that is being exposed to antibiotics. So within the guts of that animal or the pathogen which you are trying to treat, you have many of them that are susceptible to the antibiotics, and you have a few that are resistant to that antibiotics. So what that means is that when you introduce that antibiotics, the resistant pathogens survive. And after a while, they start multiplying. There's a selective pressure. And then once they start multiplying, they transmit or transfer their resistant gene to other bacteria of other family, or let me say genus, and then also to bacteria of the same species. So you have that going on and on. So antimicrobial resistance occur when microorganisms evolve to survive treatments that once effectively kill them, primarily due to misuse or overuse of antibiotics. And there are different mechanisms by which these resistant genes can be transmitted. You have conjugation, there's transduction. There's also another one which I can't remember now, but then there's mutation, they can mutate. So why is AMR a concern for us? We have found out that AMR is a global health security threat, and it also threatens the Sustainable Development Goals, especially Sustainable Development Goal 2. It can result into food insecurity. It can impact, being in good health and well-being. We have also have cases, or we have AMR pathogens even in our drinking. It will impact sanitation, the level of sanitation, the more antimicrobial resistance threats we have. Then it will also affect, the other goals like 8, 12, 13, and partnership for goals. Don't forget, AMR is a One Health global issue, which requires partnership and collaboration to fight. So another thing is that it increases morbidity and mortality. So by the year 2050, if we don't have new drugs being produced, if we don't have effective every year associated with AMR, that is huge. Then there's also the threat of cross-border spread. So it is now being considered as a silent pandemic. And then we have in Nigeria, like the last resort antibiotic show antimicrobial resistance. Alternative options to antibiotics seriously if we don't prioritize them. Addition for the treatment of resistant infection, as well as in this was I mean by antimicrobial use. So more knowledgeable, let me put it, farmers are about AMR, they lower the indiscriminate use of antibiotics. Have environment, how do I put, as a reservoir for the propagation of antibiotics, for antimicrobial resistance. Inadequate vaccine programs as well can be a driver, and I think that is the problem we have. In the poultry sector, I think we have a well-defined program for vaccination. In the pig and in the cattle, there isn't any vaccination program for the animals. I mentioned intensive productions, then inadequate veterinary services, welfare are also important drivers. The impact of antimicrobial resistance in animal health, there'll be treatment failures, and then mortality in animals, reduced animal production, reduced animal productivity, cost of animal production, and this would definitely impact on food security. And then we also have the risk of transmission of these resistant pathogens to other health sectors, to plant sector, to human sector, as well as the environmental sector. Now, let's look at AMR, a One Health perspective. Since we have to other AMR can be transmitted to other sectors. So the One Health concept recognizes that there's an interconnection between humans, animals, and the environment. And what that, I will just simplify, would mean to me is that a ripple effect on the human and the environmental sector. So AMR bacteria and genes can move from animals, they can move from animals to humans and the environment. It's a cycle. Even you can have genes moving from humans to animals, and then even from the environment to animals. So it is a cycle. AMR does not respect borders, it does not respect age, your social status, or economies. So I have another slide here that is just showing us how interconnected we are and the interconnected pathways for which, through which antibiotic resistant bacteria and their genes can disseminate across the One Health sector. And you can see, like I think I described that initially, when you give antibiotics to animals, it gets to their food indirectly to humans. You can see all the arrows there are pointing back to humans. So highlighting that this is a credit to solve the problem. So I said this would need a One Health approach to solve about collaborating. I mean, enough of doing our research, enough of doing surveillance, in silos. There is a need for us to be intentional about collaborating. There should be collaboration across the sectors to achieve optimal health outcomes for all sectors. Then AMR integrated surveillance. We should promote AMR integrated surveillance. The veterinary, medical, and the environmental sector, there's a need for us to integrate data collection, to integrate surveillance, analysis of data, in data dissemination or sharing. And then there's a need for us to improve literacy program, training our professionals, just like Generation Next, Nazi is doing right now. I mean, training on antimicrobial stewardship, alternatives to antibiotic use, and most especially vaccination and biosecurity. So now, what is the way forward? Let me talk about antimicrobial stewardship. Is very critical for, how do I put it? So for solving the issue of AMR threat. Antimicrobial stewardship simply means coordinated strategies, or do I say pragmatic coordinated strategies that promote the safe use of antimicrobials at system levels, ensure the effectiveness of antimicrobials and indiscriminate use of antimicrobials as well as AMR. So if you look at antimicrobial stewardship, it has stewardship. Is right patient or from the right animal. You are collecting the right specimen. You are using the right test to get the right diagnosis that will inform antimicrobial stewardship, which is using antibiotics, using the right drug, the right dose, the right route of administration, and then duration. So it is very important for us to know that antimicrobial stewardship also go together with diagnostic stewardship. In the veterinary context, when we are talking about antimicrobial stewardship, there is a need for us to eliminate the use of antimicrobials as growth promoters and then restrict them for prophylactic use unless it is important, or we have high-risk situations, maybe we have an outbreak of diseases. In addition to this, antimicrobial stewardship should be supported by infection prevention and control. So they are pillars for AMR mitigation. These are two. If we want to ensure responsible use of antibiotics, then there's a need for us to implement antimicrobial stewardship programs. So in the animal sector, your IPC about security of waste as well as good water stewardship in virtual research. Or those resistant tried or old or traditional methods. Then policy and governance is also very important. I will talk a bit about the Global Action Plan on Antimicrobial Resistance, which was adopted by the WHO in 2015, global framework that is implemented in several countries to help us to be able to address antimicrobial resistance using a One Health approach. And under the goal of the Global Action Plan, there are 5 pillars to it. Number 1 is education and creating awareness, which we are doing today. Creating awareness among stakeholders, that is very important. Also in the area of surveillance, where we'll be able to gather quality data and analyze and make informed decision for, and optimize, health outcomes across the one have investment in research and innovation, developing new drugs, developing vaccines, alternatives to antibiotic use, optimizing the use of antibiotics is another objective, that is implementation of antimicrobial stewardship. And then we have the last one there, that is reducing indiscriminate use of antibiotics. So for the global action plan, we have the WHO has documented that we have over virtually almost all countries of the world now have a national action plan, have developed a national action plan. So this is reflecting global political implementation. Which means there is improvement in our diagnostic capacity. I mean, improvement, there is improvement, there's still room for improvement, but we have improvements in our diagnostic capacity for AMR. And this also shows, what I just mentioned the other earlier. We have majority of countries, over 80% that have developed national action plan. And then implementation is still very low. And then multi-sectorial coordination mechanism that is across the human, animal, and environmental health is still very, very low. So if you want to read more about national action plans for different countries, the WHO has a library for AMR national action plans so that you can see how different countries have developed their action plans to coordinate antimicrobial control activities, guide policy development, strengthen surveillance, promote antimicrobial stewardship, as well as, creating and awareness and educating stakeholders, community about antimicrobial resistance. So what are the challenges we face here in low-middle income country in implementing NAPs? And not just only NAPs, implementing NAPs, which is very important. We have limited funding, there's weak surveillance systems, limited technical capacity, infrastructure, diagnostic infrastructure or capacity. There's poor coordination across. You find the animal sector doing their own, human sector doing theirs separately. There should be integration of efforts. There's poor regulation and monitoring of antibiotic use. We still have over-the-counter drugs, poor antibiotic policy. And then because we have competing national priorities, in Africa, probably our priority will be food security. So we'd rather pump in funding into enhancing food security or even facing other health issues that we think are of priority. I remember there was a time I wanted to apply for a national grant and they came back to me and said AMR is not a priority for them. So you see that our country have other priorities. So let's talk about sustainable alternatives to antibiotics. These are also very important if we want to mitigate the impact of AMR. Antimicrobials are essential tool in animal health, but not necessarily the tool. So there's a need for us to also promote the following: improved nutrition housing. There should be selective breeding for disease resistance. Then precision livestock farming, where we have used digital capacity, data, informatics, and all that to make informed decisions. The use of probiotics, vaccination, biosecurity, and then education. And I think lastly, I'm just going to talk about what we have right now as responsibility for us based on the United Nations General Assembly high-level meeting that was conducted last year. And these are we have strategic priorities for the different health sector. And the target for, let me put it this way, the target for all health sector is that we must reduce death, human death, AMR associated human death by 10%. Antibiotics used globally, I mean, we should have 70% used globally coming from the access group. So what is our strategic responsibility towards achieving these targets that is set before us? Number one, there's a need for us to strengthen biosecurity and disease prevention, farm-level biosecurity, improve infection prevention and control, encourage good practices. There's a need for us to prioritize diseases, expand on vaccination and alternatives, vaccine equity, accessibility, improve on uptake. Then also, like what we are doing today, educate more on antimicrobial stewardship. There's a need for implementation of antimicrobial stewardship in veterinary medicine, and also the restriction of antibiotics for prophylactic use and growth promotion. Research, innovation, data sharing across board is very important. We need to develop new antibiotics. We need to develop vaccines that will reduce the use of antibiotics, and we need to develop more rapid and sensitive, I would say rapid and precise diagnostic tools. Reduce AMR using the One Health approach, improving national surveillance systems, as well as promoting integrated surveillance across the health sector is part of our responsibilities now to ensure that we meet that target. And then sustainable practices, like I mentioned earlier, there's a need for us to regulate veterinary drugs, over-the-counter drugs, ensure that we have quality drugs, not substandard or falsified drugs, are being shipped into the country. And also veterinary services should be strengthened. Veterinary workforce needs to be strengthened. Diagnostics as well needs to be strengthened. So in conclusion, I'm about finishing. I just want us to take this home that AMR is a shared responsibility. We need individual and collaborative efforts. Prevention is suitable than cure. Sustainable practices will ensure livestock productivity and health and reduce and mitigate indiscriminate use of antibiotic use and antimicrobial resistance. Antimicrobial stewardship and One Health approaches are critical in combating antimicrobial use and resistance. Thank you very much for listening. Thank you.
Thank you very much for that
beautiful
presentation, ma'am. We really appreciate the knowledge you've shared with us so far. It was such an insightful conversation, and I am so sure everyone on this call have learned one or two from everything that you've said. So for me, what really stood out from the conversation, from the webinar so far, is that the importance of the interconnectedness between animal health and human health. So when we are talking about antimicrobial resistance, sometimes the conversation is always around how AMR is heavily centered on hospitals and human medicine. But in recent time, we've got to know that AMR is not just a human thing, like we need to focus on animals and our environment too. So thank you so much for doing justice to AMR and animal health. So on this note, I would open the floor for questions. I know you all have questions to ask our facilitator. So if you have question, raise up your hand or drop it in the chat box. We have just 5 minutes to do that. Thank you.
Good afternoon, everyone. That was a very good presentation, and I have learned a lot. But I have a question. Can you hear me?
Yes, she can hear you. Go ahead.
Okay. Yes, I can hear you.
So my my question is on the One Health approach. You said that there are some diseases, zoonotic diseases. Those are diseases that humans contact from the animals. I believe some of these diseases, they are microorganisms, bacteria, right? And you said that these bacteria comes from the human, from the animal to the human. Now, I want to understand how this bacteria does this, like, because these animals, we don't consume them raw like that. They undergo heat. There are some other processes. Some of them, some of these meats we consume, we sun dry them, we cook them, we fry them. So does it mean that those bacteria, they have a mechanism of resisting all those processes that are supposed to break down the gene of bacterial resistance? Is it that there is actually a mechanism they follow? Because I don't know how they should still be able to survive all those process we take before we finally consume the meat from the animal. I don't know if my question made sense.
Thank you very much for that question. I will start by defining what zoonoses are. So zoonoses are diseases that can be transmitted from animals to humans. And the zoonoses can be transmitted via different, I would say, different pathways. So you have the direct transmission, which is when you have contact with animals, you can directly, pick up those bugs. And then you also have the indirect exposure, and that is what you have just said now, maybe through the consumption of infected animal products. And I'm aware that in Nigeria, we do a lot, we cook, we fry, we boil, and all that. But don't forget that there are some bacteria that can still evade. You have heat-resistant bacteria. Is that okay? So that can still evade whatever treatments that you have put in place, and that can still get to humans. So you can get your the antibiotic resistant genes even from consuming such products. And don't forget, it is not all food that we cook. There are some food that we eat raw, like you're ready to eat food. We tend to forget our vegetables. We forget our fruits. When you use water that is contaminated with these resistant pathogens or their genes for irrigation, for agriculture, the possibility, it is possible that we have such pathogens get transmitted to these ready-to-eat food, like your fruits, your vegetables, and all that. So it is possible that we consume food, and then we consume food. It is possible that food consumption is a sure pathway for AMR transmission. I hope I'm able to answer that question.
Yes, ma. Yes, ma.
Yeah. Thank you.
Thank you, ma.
Okay, is there any more question? We have just 1 minute left before
Yes.
the end of this call. Okay, please go ahead and make it snappy.
All right. Thank you, ma. And thank you, ma, for the lectures. I just have two questions. One is that how would the microorganism know the exact gene to mutate, for them to evade the micro agents like the antibiotics? And the second question is that I don't really understand how biosecurity promotes antimicrobial resistance. Thank you, ma.
Thank you very much, Celestine. I will take your second question. I've worked severally on biosecurity, and there are emerging evidence that biosecurity is a key, I would say it plays a key role in reducing antimicrobial use, which will ultimately impact on AMR? I hope that answers the question. So your biosecurity, when we are talking about biosecurity in farm animals, biosecurity looks at 3 different components. One, you want to prevent the introduction of infection into your farm. That we call external biosecurity, or we call that bioexclusion. Then you have another component of biosecurity that helps to contain infection within that farm. So what that does is that we put some measures in place that does not allow infection to escape from that farm in case we have an outbreak on that farm. So we call that bioinclusion. And then we have biocontainment, ensuring that that pathogen does not move out of the farm to other farms. Is that okay? So when we have stringent biosecurity measures, this will reduce what we call infection pressure on the farm. So when the infection pressure is reduced on the farm, your reliance on antibiotics will be little or none. I hope you understand what I'm saying. So when anti-dependence or reliance on antibiotics is reduced, this will have impact on the development or emergence of antimicrobial resistant pathogens. What causes antimicrobial resistance is the exposure of antibiotics, is the exposure of bacteria to antibiotics. So I hope I'm able to answer that. So we have evidence that have shown biosecurity reduces or have impact on reducing antimicrobial use as well as AMR. Aside from biosecurity, even vaccination as well. Right now, the World Organization for Animal Health are prioritizing animal diseases for which vaccination will reduce antimicrobial usage as well as AMR. So biosecurity has an impact on antimicrobial use, which would ultimately have an impact on AMR. And the first question, what is the first question?
Thank you, Ma. You answered the second question very well. I'm grateful, Ma. For the first question, how will the organism, for example, organism that is resistant to rifampicin, how will they know, like all those what's it called, mycobacterium tuberculosis, how would they know the exact gene to mutate for them to be resistant to rifampicin, for example?
Okay, I'm sorry I may not be able to explain that, in detail. But, bacteria would mutate, like in my own very little knowledge about mutation, would mutate probably when the condition is not too, how do I say it now? Is it too palatable, or there is exposure to antibiotics? So it's a way of mechanism of evading antibiotic treatment. So, they mutate different ways, and then what gene evolves or what gene, develops probably would depend on the type of antibiotics they are exposed to. So we want to think about the mechanism of action of the antibiotics. So if the mechanism of action of the antibiotics is by efflux pump, probably the bacteria as well want to develop a mechanism. Do you understand what I'm saying? A mechanism of probably efflux pump. Is that okay? So they can develop their resistance based on the mechanism of action of the antibiotics you are using.
Okay, thank you very much for doing justice to all questions asked, Ma. There is a question on the chat box that say, my question is on the high resistance and low resistance antibiotics. I need more highlights, Ma.
Which high, you mean high risk, low risk? Are we talking about the aware?
Anas Al-Kasim, if you can hear me, is that what you are trying to say?
So if I get the question right, if we are talking about high, is it on?
Yeah, it's talking about high resistance and low resistance antibiotics.
Yes, I think he's talking about the aware, the WHO classification of aware. So when we say high resistance, that means that bacteria can easily develop resistance to that antibiotics. So when it is low resistance, which means resistance to that antibiotics is low. Am I making sense? So high risk resistance means that bacteria can easily develop resistance to that antibiotics. The low risk means bacteria do not easily develop resistance to that antibiotics. So that is why we have, like I said, recommendation use level and their resistance risk. So the high resistance antibiotics are the ones that we have, the WHO have categorized under the watch. So because bacteria develops resistance to them very rapidly, then we need to be cautious about the way we use them, in human, in animal, or even in the plant health sector. Because another area we've neglected aside the environmental health sector is the plant sector. We also use antibiotics in plants, to treat some plant diseases. So what that means now is that those antibiotics under the watch, these are antibiotics that bacteria can easily develop resistance to, and we need to use them with caution. The other one is the access group that the WHO right now is saddling us with the responsibility that at least 70% of antibiotics used globally must come from access, because bacteria do not develop resistance to them easily. So example of antibiotics in the access group are the penicillins, your amoxicillin. And then in the watch, you have example are your fluoroquinolones. This is badly used when you go to the poultry sector. And then you have the reserve. The reserve are the ones that we should not even touch at all. These are last resort. So if you want to treat an antibiotics when you have observed good diagnostic, stewardship, antimicrobial, you've gone through treatment guidelines, there is a need for us to use probably your first line antibiotics first before you even think of using the last resort. I hope I'm making sense. I know there was a time I went to the pharmacy and I saw the pharmacists, prescribing a last resort antibiotics for someone. I was shocked. So over-the-counter drugs as well is an area we need to look into. There should be strict antibiotic policy on assessing antibiotics over the counter. I know so many countries outside the country, so many countries, outside Nigeria, that you cannot get antibiotics even on the shelf. They are out of shelf. And you must have a veterinary prescription even before they can give you the antibiotics. And I know some countries like Sweden who are very strict with the antibiotic policy. As a veterinarian, your license can be invoked if you prescribe antibiotics indiscriminately. So it's really as strict as that in some other countries. So I think I've been able to answer that.
Yes, thank you very much for
Thank you.
your time and sharing some part of your knowledge with us. There are questions still coming in, but
I have my email.
yes, you can.
I'm happy.
Can you please
I'm happy to take questions.
Okay, yes, I'll reach out.
Yes, by email.
Yes, I'll reach
Yes,
out
please.
so that they can send their questions to your email, ma. We might not be able to answer more questions because we are far behind time. Thank you so much for
Thank you very much for having
for
me.
honoring our invitation, ma'am. We really appreciate it. So, participants, can we give Dr. Adebowale a round of applause for doing justice to this week webinar? Thank you very much. We really appreciate it.
Thank you very much.
Can I see your hands? Okay, on this note, we've come to the end of today's webinar. Bye, everyone.
Thank you.
Let's remember that we have another meeting and that training by 4 p.m. by 3 p.m. GMT. Thank you.
Thank you. Thank you for having me. Bye-bye.
Bye.
Thank you, ma'am.
Thank you.
I hope we all got that.